Over the 25 years of facial plastic surgery experience, we've developed a very unique approach to facial rejuvenation through nasal shape enhancement. We prefer not to make any incisions on the outside of the face, and therefore there are no resultant scars whatsoever on the outside of the nose when we reshape the nose for a more youthful and much more subtle appearance. What we do is we make all of our surgical approaches inside the nose, through the nostrils. There is no cut on the outside, and for that reason the patients look very naturally afterwards. They have very little discomfort, they have much less bruising than they would otherwise, and they have a very soft appearance of the nose, making their eyes look larger, making the entire facial contour and profile much more aesthetic and much more attractive. The biggest problem that people have with nasal complaints when they come in for nasal reshaping is that in many cases they can't breathe well. I mean, that is an issue. Sometimes they have snoring, sometimes they just can't breathe well. To have a pretty nose after cosmetic plastic surgery of the nose and not be able to breathe well is really not a positive thing. You really want to be able to go ahead and fix whatever difficulty the patient has in terms of nasal breathing, whether it be from allergy or from a structural problem inside the nose, and at the same time fix the aesthetic complaints of the patient, whether it's a large dorsum, a little bit of a wideness of the tip of the nose. So we really encourage patients to seek out care that will combine both a functional improvement, take care of the allergy that the patient may have, and at the same time fix the external deformity that they are concerned about. We believe that nasal reshaping surgery should be performed by a qualified and trained nasal surgeon, preferably ears, nose, and throat specialist, who then does further specialty work in cosmetic facial rejuvenation and cosmetic facial plastic surgery. That is our background. We believe that there's a functionality of the nose that needs to be attended to at the same time that you're looking at the aesthetic external appearance of the nose. So combining physiology with aesthetics really gives you the best results for functionality, for better breathing, for better appearance of the nose. We encourage you to find out more.
And Dr. Rubinstein, I had seen his work on many of my friends, and it just seemed so permanent. So I visited with him probably a handful of times and kept asking questions and looking at his work and kept asking questions, and I really felt like he was the right surgeon for me. I don't know that anything was going on, more of the fact that I just wanted to enhance what I had. And again, because it's permanent, you look at things and say, are my goals realistic? Am I going to look at this and not have a perfectionistic view? And Dr. Rubinstein just walked me through, okay, this is what we can do for you. It was absolutely perfect. So I talked to him about my nose and said, I'd like it a little smaller, but I want my same nose. Because if I get something different, what if I don't like it? And that made me very nervous. So I told him what I wanted, exactly where I wanted it, drove him almost crazy, and he did it perfectly. He did the most perfect job for me. And it's so permanent. So once you have it done, it's really hard to go back and do it again. And he was the only surgeon that, one, I would recommend, or two, that I would touch my face.